Lowering chronic inflammation in your body helps delay aging and can significantly aid in managing many chronic diseases, including cardiovascular disease, type 2 diabetes, atherosclerosis, and certain cancers.
Listen closely because this is incredibly important. Today, we're covering 3 key things: how to tell if chronic inflammation is active in your body, the warning signs to look out for, and how to effectively lower it. This video is packed with 8 minutes of pure, life-changing information, so make sure to save it and watch it a few times. First, what exactly is chronic inflammation? It is completely different from the regular infections we usually talk about. Conditions like pharyngitis, appendicitis, or gastritis are acute infections. In most cases, they have a clear location, present with swelling, heat, redness, and pain, and the underlying pathogen can be identified. Chronic inflammation, however, is a subtle state of self-attack by the body. It's like your body is constantly simmering over a low flame. It damages organs across the entire body, accelerating cardiovascular aging, forming arterial plaques, and causing blood vessels to harden and narrow, which leads to heart disease. It also accelerates cellular aging and genetic mutations, raising the risk of certain cancers. If brain neurons are constantly damaged by this inflammation, it increases the risk of cognitive impairment and dementia. An immunology expert at Stanford University pointed out that over 90% of age-related chronic diseases are linked to chronic inflammation. So, how do you know if chronic inflammation is active inside you? According to a paper by Professor Lauren from the University of Queensland, chronic inflammation often triggers these 9 warning signs. Persistent, ongoing pain.
2. Chronic fatigue or insomnia.
3. Joint stiffness. 4. Skin issues like eczema or itching. 5. Elevated inflammatory markers in blood tests, such as C-reactive protein, CRP. 6. Gastrointestinal issues like constipation, diarrhea, or acid reflux.
7. Mood disorders like depression or anxiety. 8. Unexpected weight gain or loss.
9. Frequent colds or flus.
If you experience these issues and medical checkups don't pinpoint an organic disease, you should be highly alert to active chronic inflammation.
Now for the most important part. How do we actually lower chronic inflammation? I've summarized 4 golden keys for you.
First and foremost, dietary adjustment. You need to cut back on red meat, ultra-processed foods, saturated fats, trans fats, and refined sugars, all of which have a high inflammatory index. Instead, step up your intake of whole grains, vegetables, fruits, olive oil, nuts, legumes, and deep-sea fish. Beyond what you eat, watch out for total calories. Eating until you're just 70% to 80% full can suppress the body's inflammatory response. A famous prospective controlled study found that a 25% reduction in calorie intake cut C-reactive protein, CRP levels, by 40% and tumor necrosis factor alpha levels by 50% by the 24th month.
Just a quick note. Pregnant or lactating women, growing children, and individuals with uncontrolled severe illnesses should avoid calorie restriction for now. The second tip to lower inflammation is getting a good night's sleep. Aim for 6 to 7 hours of solid sleep. Studies have found that people with chronic insomnia have much more active inflammation. Think of it this way. During the day, your body is out on a battlefield, constantly fighting off external stressors. Nighttime sleep is fundamentally for repair and reconstruction. If your body doesn't get to repair itself night after night, inflammatory markers accumulate like tiny sparks. Over time, this triggers chronic issues like type 2 diabetes, cardiovascular diseases, insulin resistance, and obesity. So sleep isn't just about restoring energy, it's directly modifying your body's chronic inflammation. The third recommendation is regular exercise.
I highly recommend moderate intensity exercise, which translates to at least 150 minutes a week of brisk walking, cycling, slow jogging, or swimming. Research shows that moderate exercise has a cooling effect on inflammatory cytokines like CRP, TNF-alpha, and IL-6.
Notice how I keep emphasizing moderate intensity. Overtraining does more harm than good. Excessive high-intensity exercise causes the body to produce massive amounts of free radicals, which actually worsens chronic inflammation. The final tip is stress relief and managing anxiety. Everyone has stress, but what matters is how you deal with it. If stress leads to chronic loneliness or anxiety, it activates the hypothalamic pituitary adrenal axis, what we call the HPA axis. This triggers a continuous release of cortisol, messing up your immune system and ramping up inflammation. Try mindfulness meditation. In 2017, Harvard University found that practicing seated meditation for just 15 minutes a week over an 8-week period altered the expression of 172 genes, most of which are tied to inflammation and metabolism. Seemingly unproductive habits like deep breathing, listening to music, journaling, or just catching up and laughing with a friend are secretly cooling down your body's internal fire. To wrap it up, chronic inflammation is the silent killer of human health. It accelerates aging and drives up the risk of countless chronic conditions. By optimizing your diet, protecting your sleep, staying active moderately, and actively winding down, you can douse the flames of chronic inflammation. Now, let me ask you, do you feel like your body is giving off any of these inflammatory signals? Do you have any other tips you want to share? Let me know in the comments below. And please share this video with that one friend who is always complaining about being exhausted and low energy, so they can check themselves too. See you next time.